We're bringing you just the facts on COVID-19, a global public health crisis. I'm Pinky Webb. Thank you for watching. It's day one of the so-called community quarantine. What it means: land, air, sea travel in and out of Metro Manila are now suspended. There are certain considerations involved, but in general, there will be limited movement with the intention of stopping or preventing the spread of COVID-19. Take a look at Metro Manila roads today. There are fewer vehicles on the roads this Sunday, which was expected. And in different parts of the National Capital Region, several checkpoints are in place. The military and the police are working together to implement these travel restrictions. It's clearly a work in progress for authorities. In a press conference today, Metro Manila Police Chief Deboldcina says they are making the necessary adjustments as the day progresses. He also made assurances to the public.
Yun yung guidance na natanggap namin. No closure of roads, no roadblock. Kung hindi, checkpoint lang. Okay, yun lang yung usapan muna. Baka hanggang ngayon, nakipag-coordinate pa sa mga barangay official concerned para makahanap po ng magandang lugar at naman po namin kung saan yung ni-required na quarantine area.
We want to go live to our Paulo Barcelon. He's standing by in Muntinlupa. What's happening around you, Paulo? Go ahead. Paulo, go ahead.
Pinky, travel restrictions here in southern Metro Manila are definitely having an effect on mobility, especially here in the southern tip of the spear, Muntinlupa City. Now, we are here at the SLEX Susana Heights exit in Muntinlupa City. Let's show our viewers what happens here in this checkpoint. Now, we can see police personnel trying to inspect the vehicles, and this is the lane which usually brings vehicles either to Manila or to Calamba in Laguna. Now, if we just move a little bit. Hello? Hello?
Paulo?
Okay. So if we, yes, Pinky, if we could just move a little bit, I'm just having a little. All right, so Pinky, if we just move a little bit, we can now see some of these workers who are putting up signs saying that this is a military checkpoint, and just beside me are the lanes which usually go towards either Manila or Calamba in Laguna. Earlier this morning, Pinky, this lane is filled up with vehicles. It's calmed down a bit, but we are expecting a rush of vehicles later in the late evening, especially when rush hour comes around 5 to 6. This exit, Pinky, is quite an important transport hub for those moving to the south, as it is usually used by those vehicles, buses, jeeps, and even multicabs nowadays to move to different places in between southern Luzon and southern part of Metro Manila. And speaking of security, just behind me, trucks laden or full of soldiers. There's also a truck that's blaring out constant advice on how to deal with the coronavirus. Now, police and the military are keeping a tight watch here. Like I mentioned, they are conducting temperature checks with thermal scanners on drivers and passengers. Motorists we talked to say they have mixed reactions regarding the implementation of these travel restrictions.
Checkpoint dito.
Okay lang ho.
Okay lang ho sa inyo? Hindi naman ho ano yung delivery apektado?
Hindi naman ho.
Ay, okay lang naman to para sa kaligtasan ng karamihan.
Natatagalan lang dito.
Well, police have also set up checkpoints in the southern part of the quarantine metropolis. In Parañaque, policemen advise bus drivers and passengers of the guidelines set by the Transportation Department. In Las Piñas, we mostly saw vans carrying workers, very likely going to Philippine Offshore Gaming Operations or POGOs. They're being scanned also for their temperature. In all checkpoints, Pinky, ambulances are on standby to bring to the hospital people who exhibit coronavirus symptoms. Meantime, time. It's not all stress and traffic here in the Susana Checkpoint 2. Earlier, we met Dr. Noel Tacorda, a dentist who gave out protective gear and face masks to the policemen who are manning this checkpoint. Police we talked to say they were grateful for the gesture.
Nagpo-proteksyon sa ating kalusugan, then afterwards, kailangan din nila ng sariling proteksyon. Pag uwi ng kanilang mga tahanan, dapat at least meron silang mga magagandang kalusugan ibabalik.
Now, Pinky, we do advise motorists here in the south to plan their trips ahead, pack a whole lot more patience, as travel restrictions will require the residents of southern Metro Manila as well as nearby towns to make more adjustments to the usual travel. Pinky?
Yeah, Paolo, can you hear me?
Yes, I can hear you loud and clear now.
Okay, Paolo, I can hear also the announcement behind you. Basically, what are they saying in the announcement? I know it's going over and over again.
It's basically my soundtrack for the whole afternoon, Pinky, but they tell us that we should wash our hands, to avoid going to public places, and most importantly, to only get their information from verified sources, such as news organizations like ours. These reminders are being blared constantly so that people inside their vehicles would be able to know the different measures in order to protect themselves from the threat of COVID-19. Pinky?
You know, Paolo, it's a Sunday today. I can imagine there's less cars going in and out of that exit in Susana Heights. However, tomorrow is a Monday, which is a work week. The government has asked some companies already to have some work from home implementation among their workers. But tomorrow will be really a test case because magdadagsaan posible. There will be more cars, and I can imagine how much longer of a wait they will have to endure compared to today.
You're right, Pinky. Earlier this morning, I was trying to get a bus in order for me to get to work. In a normal day, even on a Sunday, there are buses here that ply the Susana Heights exit 24 hours. Guess what? I was forced to ride hail because there was no buses for for more than 30 minutes. So that could only, or you could only imagine how much stressful it would be for commuters heading to different places in Metro Manila, especially with the limitation on the number of passengers that each bus could carry. That bus I tried to board on earlier this morning was already loading more than the prescribed 25 passengers, Pinky, that the DOTR guidelines have been set. So one could only imagine how much commuting could become a chore, especially in times like these for people living in the south.
Absolutely. Actually, that's where I wanted to go next, Paolo, because buses have about a capacity of 50 passengers. Jeeps have a capacity of about 12. And the guideline really is half of that. So more or less 25 for buses and about 12 for jeepneys. Anong nakita mo, Paolo, there? Were they following this, the 25 number of passengers in a bus?
So far, Pinky, yung mga bus na dumadaan dito, especially yung mga pabalik na galing ng ibang destinations or papasok ng Laguna, they carry less passengers. But early this morning, instead of 25 passengers, one bus I saw was loaded with 34. And that the conductor's explanation to me was that it has to be half the capacity, but the DOTR guidelines say that only 25 people could be carried inside the bus. That includes the driver and the conductor. So that's definitely posing a challenge to the enforcement of these guidelines that the Transport Department had set, Pinky.
That's right. Okay, Paolo Barcelon, thank you for that report from SLEX over there at the exit of Susana Heights. Thank you, Paolo. Aside from these travel restrictions, there are a few other precautionary measures that need to be implemented to prevent the spread of COVID-19. They include class suspensions in Metro Manila. That's extended until April 14th. Social distancing is encouraged, and that means keeping a safe distance from others to avoid catching or spreading the virus. That applies also in public utility vehicles, as we discussed with Paolo. Mass gatherings are prohibited. Also, the private sector is encouraged to implement work from home policies. Well, of course, it can't be helped that we are all paranoid about getting sick, but health experts are emphasizing the importance of good personal hygiene. Let's go back to basics. Joining us on the line now, our very own doctor, Freddy Gomez. Doc Freddy, good afternoon to you.
Hi, Pinky. Good afternoon. It's great to be on the show.
Thank you for joining us. Of course, we're going to have to go back to the basics, Doc Freddy. What are the things we need to remember so that we can prevent and not contract COVID-19?
Well, the first thing I think everyone should make aware is not to panic. So this virus is similar to other coronavirus that we see in that respect, that in the way it moves. So when I say that, the way it moves, the way it is passed from one person to another is just by that, through people touching things, through people sneezing. So the best way to prevent that is to stop it within ourselves. So you can do that with proper hygiene. Proper hand washing is very essential. So you've had a video on it, thank you as well. You were doing it pretty good. So you were washing your hands. There's 6 steps to washing your hands. You were doing it for at least 20 to 30 seconds, ideally. So you're doing it by singing a song. So
right.
that's an okay thing to do. But people just have to remember that washing your hands, that is the best way that you can help. You can help others. Better than trying to pass so many messages around social media. Just wash your hands frequently and properly.
Doc Freddy, washing hands and then touching the phone. How about that?
Yes, when you of course, when you touch your phone, ideally you will have to disinfect your phone with something such as probably ethyl alcohol is the best. That's what we use in the hospitals as well. Ethyl alcohol to disinfect solid objects or the things around you. But as much as possible, you do not want to touch your face or touch your mouth whenever you start going about your thing. So that is how it is spread. So also, when you feel something, when you feel an itchy throat or you really need to cough, always remember to cough either in a disposable tissue and throw it away properly, or it is advised to cough on your sleeve, or not on your sleeve, on your elbow.
Elbows, right.
Yes.
Doc, based on figures this month, COVID-19 has actually killed 3.4% of people who are sick with it. In total, that's nearly 5,400 deaths have been reported worldwide. How much of a concern is this for someone like you, a doctor, and for the public?
Right. So these figures definitely, us as medical practitioners, we take a look at this a lot. We take a look at this and we compare it with other figures, such as those that SARS has done, or MERS, or even influenza or the common cold. And what we see so far is it will vary per country. The attack rate, the mortality rate, the incidence rate will vary per country. But in general, on a global scale, we still are within those parameters. We're still around the 1.5 to 2 percentile. So over here in the Philippines, it might be around 3.5, a little bit higher than the global rate, but comparatively, we're still there. So what does that mean? That means that the way this virus is moving is still similar to that of the common cold. So the reason why it is worrisome to us now, it is worrisome, is that because it is new. It is new to human beings. So we still don't have antibodies for this, just unlike we have for the common flu or for other coronaviruses. So this is why it is not of a concern. So it is very important to listen to the Department of Health whenever they hear of limiting movement, trying to work at home, trying to do social spacing, or all of these are to ensure that this trend does not go out of control.
You mentioned that the body is not aware of the COVID-19, but we also need to remember that more than 80% of the confirmed cases of COVID-19 are actually mild, Doc Freddy, right? Because it also means these people fully recover from the disease, and there's 15% who are severely ill. In some cases, they will suffer from pneumonia, and only about 4 to 5% are critically ill from the virus. My next question, Doc Freddy, is how can you tell that it's COVID-19 versus the common cold or the flu?
That's a good question, Pinky. And the straight answer for that is you can't. You can't tell. You can't tell whether this person who is exhibiting symptoms has COVID-19 or this person just has the common flu. So, but does this mean that everyone who has symptoms of the common flu should go to the hospital get tested? No, that is not the proper way. The ideal way is to wait 14 days, self-quarantine yourself. Because the difference between COVID-19 and the flu is that it progresses. And that what we see is that the progression into more serious symptoms is seen in the elderly. So 80% of those people who are infected with COVID-19 may not even show symptoms at all. They may feel perfectly fine. So COVID-19 is in them, and then they will just go about their day perfectly fine. A small percentage of those people will have maybe moderate type of symptoms, and then even a smaller percentage will have those severe symptoms. Those who have been seen to have severe symptoms are the elderly and those who have immune systems who have already been compromised by other illnesses.
We're actually showing this to the public right now, Doc Freddy. You know, what's the difference between a cold, maybe we can put that back on air, and a flu or the coronavirus or just the coronavirus. You know, one thing that really stands out here, why a coronavirus becomes a little bit different here is because meron talagang, apart obviously from the history of travel and exposure, which some question already because there's localized transmission now, it's the shortness of breath. Can you give us more information on that? Because there's so much text messages going around about shortness of breath.
Okay. The thing about that is not all people with COVID-19 will show the symptom of shortness of breath. The shortness of breath may be a sign of the person already deteriorating into probably moderate or more severe symptoms. Now, the thing about coronaviruses, in general, not just COVID-19, they like to go to the lungs. They like lung cells, so that's where they harbor. That's where they like to multiply. That's why those who are exhibiting those severe symptoms may have shortness of breath. It might not just be COVID-19, but for other coronaviruses as well, they will have those same symptoms. So the best way to really know if this person has COVID-19 or not is through a test.
Right.
To the COVID-19 test. That is the absolute only way to be positive whether this person has COVID-19 or not.
All right.
Or just like the other viruses.
That's right. All right. Clean hands, of course, save lives, and the other recommendations of Doc Freddy Gomez. Doc Freddy, thank you so much for your time.
No problem. You're welcome, Pinky.
Thank you. This is a CNN Philippines special presentation, Just the Facts, about COVID-19. All throughout, we will be speaking to as many Metro Manila mayors as possible because we need to have a better understanding of the situation in their respective cities. In the meantime, we keep hearing the phrase social distancing. What does it really mean? Here's our Claire Sildran.
With more people getting infected with COVID-19, health authorities are appealing to everyone to practice social distancing. It is a conscious effort to reduce close contact between people and ultimately prevent the spread of any disease. Medical experts say COVID-19 is spread mainly through person-to-person contact. COVID-19 is spread through respiratory droplets when infected individuals cough or sneeze. These droplets can land anywhere, including your faces, mouths, or noses, which could then expose others to the disease. It's also possible to contract COVID-19 through contaminated surfaces and objects. So anyone touching a surface with a virus on it and then touches their own mouth and noses may get infected with the coronavirus. That is the reason why social distancing is highly encouraged. It means avoiding places where many people meet or gather. Social distancing also means keeping a safe distance of about a meter from other people. If we reduce contact with one another, we will be less likely to catch the disease. Many companies are already implementing work-from-home policies. Classes in Metro Manila and other provinces are suspended. Events have been canceled, and mass gatherings discouraged for the time being. Social distancing is an effective way to slow down or reduce transmission of any disease, especially with the way that COVID-19 is spreading worldwide. We have a huge obligation to each other. How we behave can stop the spread of COVID-19.
With the increasing number of infections worldwide, our everyday routine has changed dramatically. Today, we're seeing the first day of the so-called community quarantine. The military and police are enforcing these new travel restrictions in and out of Metro Manila until April 14, while classes will remain suspended in all levels also until then. Local government units are now working to implement these new precautionary measures. Here's our Tristan Nadalo.
Members of the military and police gear up for what they call a different kind of battle. Their weapons are not bullets and guns but face masks and thermal scanners against the coronavirus disease or COVID-19.
Police visibility po yung ginagawa namin ngayon. Pero we ensure na kami ay nakikipag-coordinate.
It's full force at the Valenzuela City May-Kawayan border. Several military trucks were deployed to help secure Metro Manila as a community quarantine takes effect Sunday morning. The guidelines so far, those who want to enter the region should show proof that they are working or have business in Metro Manila, no ifs and buts. They will also undergo temperature checks.
Ang ID na kung saan sila nagtatrabaho, napaka-importante po yun. Kung saan sila nakatira, importante din po yun. Para ma-identify natin kung ang isang tao na sinisita ay legit yung kanyang pagtawid.
It's the first day of Metro Manila's community quarantine, which means that there will be travel restrictions for those who are living and entering Metro Manila. So military and Philippine National Police personnel are deployed in different borders. We're here at the border of Valenzuela City and May-Kawayan, Bulacan.
But for some residents living near the border, they are still unsure if the military presence could really make an impact against the COVID-19 threat.
Wala, parang parang hindi ko masabi kung ano itong nangyayari na to eh. Ang wala naman sa akin kaba. Kumbaga talagang lang siguro. Kailangan.
Random checking and spot inspections were being done in Quezon City, Balintawak, and Mindanao Avenue. Police officials, however, clarified that they are not prohibiting entry to Metro Manila just yet. In Cainta, which also declared its town under community quarantine, implemented stricter protocols at its Marikina-Cainta border. But some motorists were still surprised during the inspection.
Parang nabigla kami. Kasi from Marikina, pumunta kami ng Taytay, taga-Taytay kami. Okay lang naman yun. Okay lang. Para sa kapakanan ng security.
For those who want to enter Cainta, what do they have to present or show?
Magpresenta ka lang ng company ID. Taga-ibang lugar naman po, ito hindi naman importante yung pupuntahan mo sa Cainta. Mas mabuti po muna huwag na mo munang tumuloy ng Cainta. Umiwas lang po muna tayo sa Cainta.
Health workers say those showing symptoms and fever will be brought to the nearest hospital.
Pag mataas po yung temperature, dadalhin po sa hospital ng Cainta.
Kailangan nakasakay kasi may media eh.
Pag taga-Cainta po. Pag hindi po siya taga-Cainta, kung saan po ang pinakamalapit siyang nakatira, doon po namin siya i-refer.
The metro-wide quarantine will last until April 14. Tristan Nadalo, CNN Philippines.
Cainta recorded the first 2 cases of local transmission of the coronavirus. Since then, officials heightened measures to prevent its spread. Our correspondent Zian Arcangel joins us on the line from Cainta. Zian, describe to us the situation around you.
Pinky, traffic is light along Marcos Highway, the border of Rizal Province and Marikina City, despite the checkpoint set up by authorities due to the quarantine over Cainta. No traffic buildup as there are now fewer vehicles cruising along the highway compared to this morning. Despite the smaller vehicle volume, policemen continue to strictly enforce border control as part of the quarantine. Cops ask drivers for proof of their residence in Cainta or business transactions in the municipality. Meanwhile, healthcare workers stop motorcycle riders for temperature checks. Drivers we've talked to say they don't mind the inconvenience caused by the checkpoint if it's necessary to contain the spread of the coronavirus. Mayor Kit Nieto placed Cainta under quarantine after 3 cases of COVID-19 were recorded in the city. 2 of the patients have died.
Maganda para sa kasiguridad ng mga tao.
Okay lang yan, ma'am, para maiwasan natin kumalat.
Dapat lang ho. Kasi kailangan naman talaga to.
Okay lang to, basta maging safe lang po lahat.
As part part of the quarantine, border crossing to and from Cainta shall be allowed only for work purposes. Residents can travel within the city, though unnecessary trips are discouraged. And also, holding public events is suspended while the quarantine is in place. Pinky?
Thanks a lot, Zian Arcangel. The number of people infected with the coronavirus is rising by the day. Here in the country, the total number of cases is at 111, while there are at least 8 deaths recorded. We take you to the Health Department's headquarters in Manila. Carolyn Bonkin joins us live from there. Carolyn, any update from officials?
Well, Pinky, we're still waiting for any word from health officials on how the coronavirus patients are doing. They promised to give us updates within the day. But as of this afternoon, the number of coronavirus cases in the Philippines is at 111. Yesterday, the health department announced that 47 more people tested positive of the virus. This means that the Philippines has recorded a total of 108 new cases in a span of 10 days since the first case of local transmission was recorded in early March. While most of the patients have been outside the country before testing positive of the virus, most of the patients, a lot of the huge portion or over half of the patients with profiles provided to us by the health department, it shows that many of them have not been outside the country in the past month. Most of the patients last week are from Metro Manila, and there are 2 from Rizal. But this week, we've been hearing local officials from nearby provinces like Pampanga and Batangas saying that there are also positive cases in their area. We're still waiting for updates from health officials. They said that they will give more information about PH 65 to 111. We also want to know their health status, and of course, we want to get updates from our health workers who are tirelessly working in many hospitals right now. Yesterday, health spokesperson Maria Rosario Vergeres said that 12 health workers are being observed after they've been exposed to a COVID-19 patient. That patient is PH 37. She died last Thursday. Apparently, the health workers initially diagnosed her ailment as non-communicable, and that's why they were not able to wear protective equipment against coronavirus. Again, the tally, 111 total COVID-19 cases in the Philippines. 8 died, 2 already recovered. 101 patients are still in various hospitals, but these numbers may still change as officials are still waiting for at least 70 test results. Pinky.
Right. We'll await for more information from the Department of Health. Thanks a lot, Carolyn Bonkin. Joining us now on the phone is San Juan Mayor Francis Zamora. Mayor Zamora, thank you for joining us. Good afternoon, sir. All right, I think we lost him on the line. Of course, San Juan Mayor Francis Zamora was with the MMDA last Saturday during their press conference, wherein we found out eventually that a curfew will have to be what was recommended rather by the MMDA among the Metro Manila mayors. What we need to find out right now is what the local government officials are doing in their respective areas. I think he's back on the line. Mayor Francis Zamora, are you there?
Yes, good afternoon, thank you, and to everyone listening to your program.
Mayor, what's the latest in San Juan?
Actually, I'm now presiding over a City Disaster Risk Reduction Management Council meeting, and the CDRMC has already approved the recommendation for the City Council of San Juan to declare a state of calamity here in the city. We currently have 15 positive COVID-19 patients out of the 111 in the entire country, and the council, the disaster council, has already approved this, and this will now be tackled in the special session of the city council at 5 p.m. this afternoon. But I am confident that this will be approved by this afternoon as well.
And once approved, the state of calamity will do what, sir?
This will now give us heightened authority to address the situation, and the one important thing is we will be able to release our quick response fund, or what is commonly known as the calamity fund, to be able to procure the things that we need, such as medicines, food, testing kits, emergency tents, ventilators for the hospital equipment, and all other equipment and materials needed to address the COVID-19 problem.
But as a priority, Mayor, which is most important once you get the funds from the Quick Response Fund or the Calamity Fund, sir? What do you need to buy immediately?
Well, the hospital that we have now is actually still under renovation. The previous administration was not able to complete the hospital. So right now, we really have to focus on hospital equipment pertaining to COVID-19 patients' needs. Right now, every time there is a patient from San Juan, they are confined either in a government hospital or in a private hospital. But if the number of patients really escalates, and just like now, a lot of patients are not admitted anymore in private hospitals because they're all full. So we will really need our own hospital to function properly to be able to admit our COVID-19 patients from San Juan.
Yeah, but that doesn't look like that's in the short term, sir.
Yes, but we can make makeshift isolation areas, and that will require ventilators and isolation equipment. Our current hospital administrator used to be the head of the entire Armed Forces of the Philippines Medical Center. He handled 51 hospitals nationwide, so he's very experienced, and he is on top of this situation now.
Good to know, sir. All right, so we'll continue to get more updates from you and what's happening over there in San Juan. As the mayor mentioned, 15 positive cases in San Juan. To Mayor Francis Zamora, sir, thank you so much for your time.
Thank you.
Thank you, sir. You're watching a CNN Philippines special presentation, Just the Facts. When we return, we'll speak to the General Manager of the Manila International Airport Authority for the very latest on air travel in and out of Metro Manila. Also, we have a live report from Paris. We'll find out what the French government is doing to stop the spread of COVID-19.
With the novel coronavirus spreading in different parts of the world, many are asking questions about common terms related to the virus. One of the terms is self-quarantine. With COVID-19, the recommended period to self-quarantine is 14 days. Health authorities are advising anyone who may have been exposed to someone with a confirmed case of COVID-19 to self-quarantine, or those who have traveled to countries with confirmed cases of the novel coronavirus. It doesn't matter if you have any symptoms or not. And it also doesn't mean that if you are in self-quarantine, you're also automatically sick. The idea is to take that extra precautionary step. Anyone in self-quarantine is advised to stay in their own homes, drink lots of water, eat well, and sleep well. As much as possible, stay in one room, so you also protect the people you're living with. Avoid sharing food, towels, and utensils. Wear a face mask as much as possible. And if you experience any symptoms, go see a doctor. But first, alert your doctor about your condition to allow him or her to prepare. A person in self-quarantine should not be out and about, engaging with other people. So, no work, school, and other social events and activities. Self-quarantine is about taking care of yourself and protecting those who are around you, just in case. Ruth Cabal, CNN Philippines.
Restricting land, air, and sea travel of an estimated 12 million people is a huge task. That's the goal of the so-called community quarantine that takes effect today. I'm Pinky Webb. This is a CNN Philippines special presentation. Let's check the situation at the Araneta bus terminal. Our Chrissy Dimatulak is there. Chrissy, is it any different today?
Pinky, the Araneta Center bus terminal is almost empty, with only a few buses left going to Southern Luzon inside. This is obviously the result of newly imposed travel restrictions to and from Metro Manila. For the few buses left here, they are now imposing the social distancing policy imposed by the Department of Transportation. Under this policy, all modes of public transportation should have their passengers separated at least.
Yes, Chrissy there. I'm sure she was saying that the buses there are implementing social distancing. as being told to us by government. She was saying that they are implementing a 1-meter distance, and as seen in the video earlier, the bus terminal was pretty empty. There were few buses there, and when you look at the passengers inside the bus, they are taking space, taking a number of space between them. In one row, instead of 2 people, you're only seeing 1 person, and then the next row, the same also with 1 person. I'm going to try to get Chrissy back on the line and find out exactly any more update over there at the bus terminal. Meantime, arrivals and departures of domestic flights in Metro Manila are suspended, and local airlines are extending assistance to affected passengers. Joining us on the line is the General Manager of the Manila International Airport Authority, GM Ed Monreal. GM, thank you for joining us. Good afternoon, sir.
Good afternoon, Ma'am Pinky, and to your televiewers.
Sir, can you tell us the situation right now at the terminals 1, 2, 3, and 4?
Well, first of all, based on the directive the other day, domestic operations from Manila to any point here in the country has been suspended. But the rest of the international operations are still on.
That's right. I was talking to you a while ago, GM, and the domestic flights obviously at terminals 2, 3, and 4, that's suspended, but there are terminals that also service international flights.
That is correct, ma'am.
Can you, GM, when you talk to some people or get text messages, there are a number of questions that they want to ask that I'm sure you can answer for them. For example, sir, for people coming into Manila, it's an international flight. Obviously, that will be allowed, sir. What happens to them? For example, OFWs who come home, or just anybody who wants to come to the Philippines but need to travel to another province. They can't take any flight from Manila. What do? They need to go to Clark, sir?
Well, that is the option that they have to take. They have to take a land transfer from terminals 1, 2, 3 to go to Clark.
Mm-hmm.
Should there be flights out there, then obviously they can use that airport for them to reach the other provinces.
But for obvious reasons, GM, they need to find out first and foremost if their destination, if Clark actually services their next destination, which province they're actually going to.
That is correct. I spoke with the Airline Operators Council chairman, and since about 2 days ago, they have been telling their passengers already that if that Metro Manila is currently quarantined area, so if they are flying out of Manila to other destinations within the country, they're suggesting to either use Clark, or if there are flights that go direct to Cebu, unless there's a different regulations in Cebu, they'd rather go direct to where they should be going rather than passing through Manila.
Yeah, it's really try to avoid Manila if you need to go to another destination from Metro Manila, because you will be experiencing, that'll be a challenge for the passengers. GM, I wonder if you can also help us. There are some passengers who may have been stuck in various areas, possibly maybe Batanes. I remember seeing a tweet about that, sir. Has there been any move from the local carriers to service recovery flights yesterday, sir, because the ban or the suspension begins today?
Well,
Meron ho bang mga naipit, GM?
Meron ho akong kaming natatanggap na mga request. Yan, sabi mo nyo nga, sa Batanes, meron din ho sa South. Kahapon ho, we convinced our local carriers to do a sweeper flight, kung tawagin, meaning they'll mount an extra flight to bring in those passengers before the closure or the quarantine for Metro Manila. I don't know if that pushed through, but as of the moment, we're trying to convince airlines to mount flights from Clark to other destinations where the demand is high, meaning there are requirements from passengers.
But my question there, GM, is I can imagine that the flights in Clark already are quite full from the normal schedules they have. And to mount more flights there might end up to be impossible, GM?
I don't think so. We still have the space. We still, no, Clark is not really maximized in terms of utilization. The challenge right now is basically for the local airlines to bring the logistical support to Clark. So that's one thing that I guess our local carriers should address. Hopefully they'll be able to do that in the service of the passengers.
On a last note, GM, I know you are with MIA, but do you know how many flights in general were added in the Clark International Airport?
Unfortunately, I don't have the figures right now, ma'am. I can probably check it for you and then probably text it after the show or whatever.
Okay, thanks a lot, GM Ed Monreal. Thank you, as usual, sir.
Thank you.
All ports in Metro Manila are, of course, also covered by the new travel restrictions. A full alert status is in place, as well as a no-sail policy along Manila Bay. Starting today, let's now speak to Philippine Coast Guard spokesperson, Commodore Armand Balilo. Sir, welcome to the show. Thank you for taking our call.
Thank you. Good afternoon. Good afternoon to all your televiewers.
Sir, best to get from you, what's the situation along the ports, among the ports?
Well, first, in Metro Manila, the Philippine Coast Guard and PNP Maritime Group have implemented the no-sail policy for the passenger vessels. Likewise, we have deployed medical teams to check the health conditions of the crew of cargo vessels entering the Port of Manila, to include the ferry terminals in MOA and CCP going to Cavite and Bataan, and also the Pasig Ferry Station. And on outside Manila, we have alerted all our units nationwide to implement the no-sail policy should the local governments in their respective area of responsibility will declare community quarantine. At present, Cebu, I think Bohol, Oriental Mindoro, Iloilo have declared community quarantine. So sa ngayon, nag-ready kami na implement na wala ng passenger vessels. Of course, the cargo vessels will be allowed to sail because we don't want na yung mga provisions hindi makarating dun sa mga paroroonan nila.
So because Cebu, Bohol, and Iloilo, as you mentioned, sir, are doing their own self-community quarantine, what you're saying, sa mga kababayan po natin, especially over there in those three places, sir, you're already telling them na absolutely walang iikot even around that area now ng mga barko.
Yes, passenger vessels will not be allowed anymore. So at this point pa lang, they should decide already not to, kung mabiyahe sila, dahil meron ng ini-impose yung local government, they should stay home.
Kasi there's no way, sir, na makakalayag pa sila.
Yes, we are going to patrol kasi meron na kaming mga nakita na gumagamit ng mga small boats.
Yes.
And we will not allow that, and we will check kung saan pupunta. Pag nalaman naming passengers ang dala nila, ihilahin namin yung bangka.
So you've seen a few, sir, in spite of the ban?
Meron lang isang report dito sa Nabotas, but sinabihan na namin. And we've warned the other motorboats already.
Yeah. I want to ask about the cargo vessels, sir, that come in and out. What kind of security measures are in place?
Well, we are monitoring all the cargo vessels coming here in our ports, especially in the Port of Manila. We have tracking devices like the C-Vision. Binabacktrack namin kung saan talaga galing at kung nagdi-declare, lalo na kung foreign vessel, kung nagdi-declare ng tamang dates. Because the requirement, they should go into quarantine procedure for 14 days bago pumunta rito sa Pilipinas, sa port natin. And if that, meron kaming nahuli dati na fraudulently altered yung kanilang date from where they came from. And we advised them and hindi na namin sila pinatuloy dito sa Pilipinas.
That's very important.
So things like that, we have the regular protocol for checking the vessel coming here, the usual customs, immigration, and quarantine. And for the domestic vessel, we have the health protocol that we have imposed this morning na lahat ng crew, bago bumaba, papanikin ng mga medical personnel namin at i-check yung mga temperature nila.
It's really best to do that, no, Commodore Balilo, because what happens is they can, as you mentioned, edit their date of departure kung saan po sila nanggaling. Hindi ho ba?
Oo, kaya nga we are also using all available means, no, mga surveillance system para ma-check namin na tama yung mga declaration nitong mga barko to but before they enter the Philippine ports.
Okay, so malinaw, cargo vessels are still allowed to go in and out. Of course, sea travel has been suspended, even sailing, even small boats, as mentioned by Commodore Balilo. Hindi na po pwede yan.
Pati mga fishing boats, pwede naman.
Pwede. Okay. Yun po pwede. Alright, maraming salamat po sa inyo, Commodore Armand Balilo, Philippine Coast Guard spokesperson.
Thank you, Pinky.
Let's check now how local government units in Metro Manila are responding to the implementation of the community quarantine. Our correspondent, David Santos, joins us live from Marikina. David.
Well, the mayors and representatives of the 17 cities and municipalities in Metro Manila did agree unanimously on Saturday to implement the nighttime curfew beginning today, March 15. The curfew will be supposed to be from 8 in the evening until 5 in the morning, but the Council of Mayors had to take back that decision, as we all know. This comes after the Justice as well as the Interior Departments pointing out that a local ordinance is required for each city before a curfew could be implemented. The Metro Manila mayors conceded, so their respective local legislative councils will have to convene and pass that ordinance. Now, at least 2 cities, as we know, Muntinlupa and the city of Manila, held special city council sessions yesterday precisely to do this. The rest are expected to pass their respective local ordinances by Monday. Back to you.
Thanks a lot, David Santos. You're watching a CNN Philippines special presentation, Just the Facts. Stay with us.
It's nothing like I expected.
Lisa Merck is speaking out from isolation in her Crested Butte home.
Yes, I have coronavirus. I didn't go out and get it on purpose.
The Air Force veteran doesn't know where she picked it up. No international travel, just a 3-week trip with her husband to Hawaii.
I went to a medical conference over there. And on the day that we were getting ready to leave, I just kind of started having just little sniffles.
Looking back, that's where it all started. Sniffles, then a left side body ache on the plane ride home to Crested Butte, where she's an advanced practice nurse.
We got back to Crested Butte and my muscles ached and my joints ached really bad. It felt like somebody was like stabbing me with an ice pick. And I'm like, I wonder if I have the flu or...
Flu tests came back negative. Then aches came with nausea. In the first 3 days of March, fever started. That's when she called the CDC.
I told them like where we had traveled, kind of what was going on, and they said I didn't meet criteria, so I was fine with that.
But she didn't feel fine for days to come.
And then finally on Sunday night, I told my husband, I'm like, you need to take me to the ER. I'm just like not feeling very good. I feel like whenever I stand up, I want to collapse.
Doctors at the ER said she had viral pneumonia. They tested her for coronavirus and results came back positive. In this time, she's probably lost 5 pounds due to the nausea. The muscle aches are the worst, but she's on the mend.
I'm feeling like just really short of breath. I get extremely exhausted, and but I feel like I'm definitely getting healthier.
We live in a time of anxiety and uncertainty. Many of us are worried about COVID-19, and we can't emphasize enough the importance of good personal hygiene as our best defense. This is a CNN Philippines special presentation, Just the Facts. I'm Pinky Webb. Let's go back to our Chrissy Di Matulak. She's standing by at the Araneta bus terminal. Chrissy, we lost you earlier. Tell us what's happening there now.
Pinky, the Araneta Center bus terminal is almost empty with only a few buses going to southern Luzon inside. This is obviously the result of newly imposed travel restrictions to and from Metro Manila. For the few buses here, they are now implementing the social distancing policy imposed by the Department of Transportation. Under this policy, all modes of public transportation should have their passengers separated at least 1 seat apart. The number of passengers is also limited. Bus drivers we spoke to say they are implementing stricter measures for passengers and ensuring that COVID-19 does not spread through the provinces.
Sumusunod sila kasi sinasabi din namin na kung ayaw nilang sumunod, papababain sila. Hinaanapan po namin sila ng ID bago po sila umakyat ng kaya matagal umakyat.
bus operators were distributing checklists to passengers where they can disclose their travel history in the past 14 days and any flu-like symptoms they may be feeling. Meanwhile, it's a different scenario in jeepneys and UV shuttles as they have yet to impose the social distancing policy. According to drivers we spoke with earlier, their operators have not informed them yet of the guidelines. Some say that if they cut their capacity to almost half, their earnings will be greatly affected. According to Land Transportation Franchising and Regulatory Board Chair Martin Delgra, it is the duty of operators to inform their drivers on COVID-19 safety measures. Pinky?
Thanks a lot, Chrissy De Matula. The military and the police are implementing these new travel restrictions in and out of Metro Manila to stop the spread of COVID-19. Joining us now on the phone, PNP Deputy Chief of Operations, Guillermo Elazar. Sir, maraming salamat for taking our call. Good afternoon. All right, we'll try to get him back on the line. I believe we just lost him a while ago. So there are, as mentioned a while ago by NCRPO Chief Debold Sinas, there are no road closures, but what we have are checkpoints for now. In fact, our Paulo Barcelon was over there at SLEX at the Susana Heights exit, where we saw a number of military men looking into the cars, checking the cars, and the drivers passing through that particular area. So it's a work, there's still rules and regulations that need to be implemented, but they cannot arrest people, as mentioned by NCRPO Chief Debold Sinas, but they can issue warnings to those who are not following the protocols set by government. Elsewhere, in different parts of the country, a 64-year-old counselor in a Negros Oriental town has died due to the novel coronavirus. He visited Green Hills in San Juan and attended a convention in SMX Convention Center in Pasay City. This now brings the COVID-19 death toll in the country to 9. Meantime, leaders in several towns and provinces have implemented their own measures to stop the spread of the coronavirus. In Luzon, Cainta in Rizal, Oriental Mindoro, Coron in Palawan, and Aurora, they're banning non-residents from entering and leaving the province. Ilocos Norte also says it is suspending classes indefinitely. Let's go to the Visayas. Tourist destinations such as Cebu and Bohol turned away domestic and international tourists coming from any land, air, and sea ports. There is also a curfew from 10 p.m. to 5 a.m. in the entire province of Cebu, which will last for 30 days. Classes are also suspended in Negros Occidental and Negros Oriental. And in Mindanao, Davao City has been placed under community quarantine. It also urges visitors to postpone their travels and leave the city immediately. Cotabato City is closing its borders to outsiders starting Monday, and Zamboanga City is imposing suspensions in classes, transportation, and jail visitations. You're watching a CNN Philippines special presentation, Just the Facts. Stay with us.
Mga balita at impormasyon sa daan, aming ihahatid ng walang patid. Meron ka bang tanong o reklamo? Tutugunan natin yan. Ako si Ruth Cabal. Araw-araw makakasama natin ang mga eksperto para himayin ang mga isyong malapit sa puso ng ating mga commuter at motorista. Sakay na, Lunes hanggang Biyernes, 5:30 ng hapon, Busina Balita sa CNN Philippines.
Ang pinaka-importante talaga is to move a story that affects the Filipinos. Kung ano talaga makaka-apekto, ano yung gustong malaman ng mga Pilipino. At 12 noon, marami na kasing nangyayari at meron kaming balita from, let's say, this morning na kailangan naming i-move forward. Gusto ko pag nanood sila, nadala namin yung story to another level. May added information sila. Pagkatapos nilang manood, nasabi nila na, oh, ito nangyari, may bago na, at napanood namin doon sa balitaan. All over the world, the coronavirus is spreading. Over 142,000 people are sick with COVID-19 globally. Here in the Philippines, a number of people infected is at 180. 11. Let's now talk to Marikina Mayor Marcy Teodoro, who joins us on the phone. Mayor, thank you for taking our call. Good afternoon to you.
Yeah, good afternoon. Thank you.
Sir, kamusta po ang inyong ini-implement na mga measures dyan po ngayon sa Marikina?
Katatapos ko lang kausapin tong aming chief of police dahil sila yung namamahala dun sa tinatawag namin boundary control points. It's a control points because we're not implementing naman total ban on movement of people. We're simply restricting and ensuring that transmission of this COVID virus will be contained accordingly and timely. Una, sinisiguro namin yung free movement ng mga goods and other services dito sa loob ng city para yung supply chain natin ng mga pagkain and other basic necessities ay manatiling meron tayo. At yung ating price freeze, meron tayong pinatutupad. At yung hoarding is we are aggressively implementing that hoarding will not occur in the city. This is in preparation really for tomorrow's full, shall we say, actual implementation. Ngayon linggo kasi kaya yung movement ng tao, limited pa rin.
That's right,
ng
sir.
mga tao nasa bahay pa nila. Bukas ito, mga magtatrabaho na, papasok na sa kanilang mga opisina. Kaya in-expect namin na nire-review namin yung protocols. Even our personal assigned, we're orienting them on how to handle cases tomorrow.
Yeah.
There are people, for example, might be rushing a member of the family to a hospital. So, paano yung dealing dito? Siyempre, papayagan natin to dahil yung mga humanitarian and medical travel are allowed.
Yeah, I think tomorrow, sir, will really be, I guess, a little bit more.
The true test.
It'll prove to be a challenge tomorrow, Mayor. All right, so, sir, I'd like to thank you for your time. Mayor, patuloy po kaming makikipag-ugnayan sa inyo. Maraming salamat po sa inyo, Mayor Marcy Teodoro.
Yeah, salamat din po at mabuhay po kayo.
Thank you, sir. This has been a CNN Philippines special presentation. I'm Pinky Webb. Spread facts and not fear. Thank you for watching.